Hi, my name's Tony. I'm an inspector with WorkSafe Tasmania.
And I'm Kylie, and we are two of 30 inspectors working across Tasmania, helping workplaces to manage their COVID-19 risks.
We've been doing our bit to help in the fight against the COVID-19 pandemic, keeping workers and the community safe, and we wanted to take a minute to share with you what we do when we come into your workplace.
Inspectors are allocated a regional area, and our role is to go door to door talking to workplaces about how they are managing their COVID-19 risks. Our goal is to educate employers how to reduce the risk of the spread of COVID-19, but more importantly, make it simple for people to understand how to comply with these requirements and keep their workers and customers safe.
We focus on working through the minimum requirements as specified in the public health orders. We hope this has helped you better understand what to expect when an inspector comes to your workplace. We both look forward to seeing you soon, and remember, stay COVID safe.
Under the public health direction, you must document the measures you are putting in place to manage the risk of COVID-19. When an inspector arrives at the workplace, we will ask to see your COVID safety plan. It shows how you have assessed the risks in your workplace and the control measures you have implemented. It is a simple summary that the inspector will work through with you while looking at the way your control measures are working.
An important part of reducing the impact of COVID-19 outbreak is being able to find people who may have been exposed to COVID-19 through your workplace. If you have any records of people who have entered the workplace, for example a booking calendar or CCTV, you must keep those records for at least 21 days.